back pain. It's very, very common. I think it, together with the chest pain, is one of the most common reasons to visit the ER and also primary care. You have very different types of back pain, but the most common is the lower back pain. When should you definitely go to the ER? When it's associated with a fever, meaning that you didn't have a back pain and suddenly you develop it together with fever. Well, then probably there's the probability that you have an infection on your back, which is very uncommon. But if you have those two things together, you should definitely go. If it lasts more than 6 weeks, you should go. If you have any history of cancer, not your family, but you, of course, you should go, because the spine is one of the places where lots of cancers like to go and make metastasis. So you should go to your doctor. If you have any urinary symptoms, meaning it's painful to urinate, you feel when you urinate that you still want to pee, or you're urinating blood, then you should definitely go, 'cause it might be either a problem directly in the kidneys or simply a urinary tract infection. If you're immunosuppressed, either because you have HIV, or you have um, immune deficiency of any kind, or if you are taking um, medications like steroids, or medications like Xolair, or any biological, how they call them today, then you should definitely visit your doctor. And people who are 15 years or younger with a back pain that it's definitely interfering with their daily activities, because kids, they do have pains on their legs, on their arms, and they call that growing pains, or but back pain that definitely makes them stop their activities. Maybe that's something you should pay attention. So that's a reason. And of course, if you had a trauma, you should definitely go, because they need to clear that you don't have dislocation or a fracture. And of course, if that pain goes to your legs, to your feet, to your buttocks, then I put a star there, because that's maybe for a primary, not necessarily an emergency room, but maybe you should get that checked, because it might be because you have either a herniated disc, or maybe a pinched nerve.